Hi, today we're going to talk about the EZpap. So the first thing you're going to do is check the patient's chart, make sure we don't need, or we're going to check for any contraindications, untreated pneumothorax, any facial trauma, throwing up blood. The patient does need to be alert and oriented, so that's something to consider if we're going to do this therapy. This is to prevent and to treat atelectasis. So we're going to go ahead and collect our supplies, go into the patient's room. We can hook up aerosol medication to this. It would hook up right here after the oxygen or air connector. And we have a manometer that we would connect to. This comes apart, connected on here. Oxygen units hooked up here. And then we'll go ahead and hook up our tubing either to air or to oxygen. We'll start off the patient at 5 liters. We can increase it all the way up to 15 liters. We want the patient's pressures to be in between 10 to 15 centimeters of water pressure. So we need 15 is usually a therapeutic range, and we can adjust that with the flow that we're giving the patient. So we can increase the flow if they're having a hard time reaching their designated area. This little piece here will give the patient a visual to where we want to reach, and we'll just make sure we instruct the patient to secure their mouth around the mouthpiece, and that we want them just to breathe normally throughout the therapy. This is positive airway pressure therapy, so what it is doing is opening up those alveoli and preventing atelectasis or treating atelectasis. So it's just a couple minutes of therapy. This stays with the patient, so we'll probably do this a couple times throughout the day. Definitely before we do treatment, we're going to listen to the patient's airways, their breath sounds, and we'll closely monitor the respiration rate throughout this because we don't want them to hyperventilate. After treatment, we'll go ahead and check their breath sounds again and make sure the patient is comfortable. And that's it.